want to talk about diverticulitis today. First of all, diverticulitis, what is it? In our colon, it is like a long tube, but in some patients, part of the colon wall becomes a little bit thin, so it bulges outside. It's like a little depression, it's like a little pothole. It's not a perforation per se, but it's just the wall of the colon. Instead of smooth, it bulges underneath. So there's a pocket and pocket along the colon. We call it diverticulosis, just a bit of outbulging of the colon. Sometimes feces get stuck into this part and cause inflammation. Sometimes bacteria change or bacteria inside the lumen of the intestine, or sometimes because of the pressure of the intestine, they affect the blood supply for the diverticulosis and they become infected or inflamed. When that happens, patients present with severe tummy pain, where it can be the left, middle, or the right. It's pain, quite severe, maybe 7 to 8 upon 10. They worse when they touch it, worse when they laugh, and they turn worse when they strain the abdominal wall. They often have fever and they feel very unwell. In the worst case scenario, they even vomit and a fever. The worst case I've ever seen was that the diverticulitis, the infection of the colon was so bad that the intestine ruptured. The feces go to the perineal cavity, they got the abdominal abscess, big hoo-ha. So don't wait till then. When you have severe tummy pain, just go and see a doctor. How do we confirm the diagnosis? First, when we examine the patient, we touch the belly, there can be somewhat weaker tenderness. When we touch it, there's some pain. And later on, we do a CT scan. The scan will show that the wall of the colon should be a few millimeter. That part can become half a cm, even 1 centimeter in the thickness of the colon. So that correlate, and we see pocket of air to confirm it's diverticulitis. In the worst case scenario, the colon wall was so badly inflamed that it ruptured. We'll see feces outside the intestine. We'll see abdominal abscesses. Nowadays, very rare because people are smarter, they see doctor earlier. How do we treat? Number one is gut rest. We rest the gut, ask them don't take anything, just drink plain water. They eat something a lot in particular. When they make the intestine move, they have a lot of pain. Number two, we give antibiotic to treat the infection. Most of my patients feel much better after the first dose of antibiotic going in. They tend to stay in the hospital for a few days. Some studies show that antibiotic may not make a difference, but I personally find that antibiotic make a huge difference. Number three, we rest the gut. When they are better, we let them eat some porridge. When they are better, we let them eat rice. Most of the patients stay for maybe 4 days in the hospital with antibiotic and IV fluid. We rest the gut. When the pain better, we feed them. They'll be okay. One common question people ask is, why do I get diverticulitis? My answer is, we don't know why you get it. I call it bad luck. We know that sometimes changing the bacterial flora in the intestine can cause that. Sometimes feces jamming in the colon can cause that. But we know that if you catch it early, we treat it early, they'll be okay. Roughly 1 in 5 of the patients with diverticulitis may have a recurrence. So we ask them, watch out for that. When you have a problem, come back. Also, sometimes diverticulitis patient may be harboring something else to cause the colon to be thick, like a polyp or even cancer. So it's recommended that if you have a diverticulitis, you should have a colonoscopy maybe 1 or 2 months after the resolution to be sure that nothing else, only diverticulosis inside, no polyp, no cancer. To prevent it from coming back again, there are several methods. Studies have shown that there are few type of patients have a higher risk of diverticulitis coming back. Number one, overweight patient. Number two, people that take a lot of red meat. Number three, people that take not enough vegetable in the diet. Number four, people that do not exercise. So to reduce the risk of diverticulitis coming back, maybe you should eat a healthier diet, like more plant-based food, less red meat, cut the weight down, and be involved in the physical exercise and don't be fat, okay? Now, but all these measures may not help. What I'm saying is these are the factors that are associated with recurrence, but there's no guarantee that if you do all these things, they will not come back. I've personally seen many thin, fit patients that keep having diverticulitis. So even though the diverticulitis is associated with all these risk factors like overweight, no exercise, a lot of red meat, not enough vegetable, there's no guarantee that you change the lifestyle, you can have lesser risk. Some studies have shown that if you give them a special medicine called rifaximin to change the bacterial flora in the intestine, change the microbiota in the intestine, they may have a lesser recurrence. I tried that on a few patients, they work. So if you do have recurrent diverticulitis, talk to your doctor about cyclical rifaximin. At the end of the day, some of my patients get so fed up about the diverticulitis that they don't want to take any more chance. They don't want to have a diverticulitis that occurring when they're in Bali or on the plane to Australia. So the only sure way to remove it is to cut out the intestine. Locate where the diverticulosis is, find out which segment always get infected, chop it out intestine, join together. But colectomy or removal of the colon is a very serious thing. It's a big operation. I personally do not recommend, except it's really the last resort. So to sum up, diverticulitis is infection of the diverticulosis in the colon, of those outpouching of the colon. They present with tummy pain, see your doctor. We rest the gut, we start antibiotic. Almost most of my patients will recover. I hardly see a perforation of the diverticulitis anymore. And certain risk factors like overweight, no exercise, a lot of red meat, not enough vegetable, these are the factors associated with recurrent diverticulitis. So try to live a healthy lifestyle. If you keep coming back, talk to your doctor about psychical reflexomy. If it's really bad, do a surgery to take out the colon. Dr. Desmond White.